So in terms of its endocrine disruption pathways, it may play a role in a variety of endocrine disruption conditions, including female and male infertility, precocious puberty, hormone-dependent tumors like breast and prostate cancer, endometrial hyperplasia, PCOS, polycystic ovarian syndrome, insulin resistance, diabetes, and NAFLD. So here we have our bisphenol A or its analogs, unfortunately. Then we have the making plastics and epoxy resins and water bottles and a variety of other things. It bioaccumulates, it biomagnifies in the aquatic food chain. We take it into our bodies. It's found in 93% of Americans, so pretty much everybody has it. And it has multiple mechanisms down here, which eventually leads to these unfortunate health outcomes. So that's that. All right, humans with higher BPA serum levels, higher BPA serum levels are twice as likely to develop diabetes than those with lower BPA levels, with increased diabetes risk in lifespan timing, meaning obviously the older that we get, the more higher the risk that we are. So twice as likely to develop diabetes. So BPA and metabolic disease is a big deal, in my opinion. Clear relationship between BPA and metabolic problems, including obesity, insulin resistance, type 2 diabetes, hypertension, and cardiovascular and non-alcoholic fatty liver disease all exist. Exposure models used have been based on the assumption that BPA is almost entirely food-based, such that BPA would be subjected to extensive first-pass metabolism. So we're thinking, okay, it's only food-based, but now we know that you can also get transdermal absorption from BPA-coated thermal paper and a variety of other means. And even when you use hand sanitizer, this is my favorite. People go to the grocery store, they get a receipt, and they squirt hand sanitizer on their hands right afterwards as they're handling this paper. Well, now we know that that actually enhances the BPA absorption directly into your hand. Or the people at the front desk, obviously people are still very concerned about spreading germs. And I always feel for the people, the cashiers who are putting this hand sanitizer on their hands every day after handling this thermal paper. So I definitely am concerned about those folks. That again can result in basically we're accumulating these things inside the body. And basically we get these higher levels of bioactive BPAs that we've seen in different types of studies. BPA has an insulinotropic effect, meaning that it has some kind of insulin action. It impairs several components of insulin-induced glucose uptake. It can also affect the expression of GLUT4 translocation to the cells, and BPA binding to pancreatic islet cells can induce impaired insulin or glucagon secretion, leading to insulin resistance. So BPA in and of itself. I really like this picture here. This is great. So again, kind of looking at the fundamentals of glucose metabolism. So we should have glucose insulin binding to the insulin receptor here on the outside of the cell, should have that. And then glucose transporter vesicles are made inside the cell and they go to the cell surface where glucose is then absorbed, right? So that's kind of how things happen normally. However, in the presence of BPA here, you can see BPA affects this pathway at multiple different steps. Here, first and foremost with insulin binding to the insulin receptor, causing insulin resistance. Basically causing insulin to be properly made or internalized inside the cell, or some kind of internalized activity inside the cell to be able to metabolize sugar, and also again blocking these GLUT vesicles from either being made or translocating to the cell surface to have the uptake of glucose inside the cell. So in essence, we end up in an insulin resistant state. We end up with glucose that's then eventually packaged into fat, and we have more lipogenesis happening and more glucose circulating around, which obviously can lead to prediabetes and then diabetes itself. So in terms of looking at the research in BPA and diabetes, a meta-analysis of 41,000 subjects showed that BPA concentrations in human biospecimens were positively associated with type 2 diabetes risk, and a sensitivity analysis indicated that urine BPA concentrations were positively associated with type 2 diabetes risk. Again, 2 times higher risk. Adult male mice treated with the BPA injections. They were treated with BPA injections compared with the levels in mice treated with estrogen. estradiol, and a control group treated with corn oil. The BPA caused oversecretion of insulin in mice at a dose of 10 micrograms per kilograms body weight via a rapid mechanism taking 15 to 30 minutes. 15 to 30 minutes. That's how long it took to kind of have this insulinotropic activity. That's really very, very interesting. And then treatment over the course of 4 days with 100 micrograms per kilograms per day induced insulin resistance that preceded type 2 diabetes. So of course, that can lead to things like NAFLD and obesity and a variety of other downstream sequelae. Estrogen, interestingly enough, had the same effects at the same dosages, and glucose metabolism remained stable in the control rats who were fed corn oil. So again, it has some kind of estrogenic-like activity and some kind of relationship here between the insulin receptor and estrogen. And another study here, BPA dose that was high enough to cause insulin resistance in mice was in the same range as the 50 micrograms per kilograms per day reference dose established by the EPA, which is based on a lowest observed adverse effect level of 50 milligrams per kilograms per day. So the researchers saw the newly discovered link between BPA and insulin resistance as one more reason the agency should at least consider lowering the lowest observed adverse level effect, because we're having effects that are at the lowest effect level. So we really need to think about lowering this level, because that can cause insulin resistance even at the lowest dose.